Hello friends, today we will be studying about the abdominal part of esophagus. The abdominal part of the esophagus is only about 1.25 cm long. It enters the abdomen through the esophageal opening of the diaphragm situated at the level of vertebrae T10, slightly to the left of the median plane, and it continues with the cardiac end of the stomach. Now let's see the figure of abdominal part of esophagus. So the esophagus is 1.25 cm long. It enters the abdomen through the esophageal opening of the diaphragm situated at the level of vertebrae T10, slightly to the left of the median plane, and it continues with the cardiac end of the stomach. The esophageal opening also transmits the anterior and posterior gastric nerves, the esophageal branches of the left gastric artery, and accompanying veins. These veins of esophagus drain partly into portal and partly into systemic circulation. Veins accompanying left gastric vein drain into portal vein. Others drain into hemiazygos in thoracic cavity and continue into vena azygosa and superior vena cava, so it is a site of portosystemic anastomosis. The esophagus runs downwards and to the left in front of the left crus of the diaphragm and of the inferior surface of the left lobe of the liver, and ends by opening into the cardiac end of the stomach at the level of vertebrae T11, about 2.5 cm to the left of the median plane. Its right border is continuous with the less curvature of the stomach, whereas its left border is separated from the fundus of the stomach by the cardiac notch. Peritoneum covers the esophagus only anteriorly and on the left side. Anterior gastric nerve contains mainly the left vagal fibers, and the post-gastric nerve contains mainly the right vagal fibers. Each gastric nerve is represented by one or two trunks and combines a few sympathetic fibers from the greater splanchnic nerve. Now let's see its clinical anatomy. The lower end of the esophagus is one of the most important sites for portosystemic anastomosis. In portal hypertension, the anastomosis open and form venous dilations called esophageal varices. Their rupture causes severe and dangerous hematemesis, that is vomiting of blood. Here we can see the figure of esophageal varices at the lower end of the esophagus. So in portal hypertension, the anastomosis open and form venous dilations, that is called as esophageal varices, and their rupture causes severe and dangerous hematemesis, that is vomiting of blood. Normally the lower end of the esophagus remains closed and it dilates only during the passage of food. However, due to neuromuscular incoordination, it may fail to dilate, leading to difficulty in passage of food or dysphagia. This condition is known as Echolasia Cardia. Marked dilation of the esophagus may occur due to collection of food in it. Here we can see the condition of Echolasia Cardia, in which the lower esophageal sphincter fails to relax, that is, fails to dilate because of neuromuscular incoordination. There is no movement of food, that is, no peristalsis occurs, due to which the foods get collected in the esophagus, making it dilate. The lower end of the esophagus is also prone to inflammation or ulceration by regurgitation of the acid from the stomach. It is the commonest site of esophageal carcinoma. Next site is the middle third of the esophagus. Now let's see hiatal hernia. It occurs through the esophageal opening and can be rolling or paraesophageal and sliding. Here we can see the figure of hiatal hernia. This one is rolling type or para-esophageal type, and figure B is of sliding type. Now let's talk about Barrett's esophagus. The squamous epithelium of lower esophagus may be replaced by columnar epithelium in certain clinical conditions, which is abnormal type of epithelium. Tracheoesophageal fistula. At times, the separation of trachea and esophagus may not be complete. Proximal segment ends in a blind pouch and a distal segment communicates with trachea. Here we can see the figure of tracheoesophageal fistula, where the separation of trachea and esophagus is not complete and the proximal segment ends in a blind pouch and the distal segment communicates with trachea. The proximal segment is also known as esophageal atresia. The lumen of esophagus may be abnormally narrowed due to improper canalization. The lumen of esophagus may not be canalized at all, leading to esophageal stenosis. So here we completed about the abdominal part of esophagus. Please like, share and subscribe for more videos. Thank you.